Hi students, this is Dr. Badrinath. Today's topic is very important for all regular and competitive examinations, penicillins and cephalosporins. Okay, penicillins and cephalosporins. Penicillins are the first antibiotics that we know very well. Okay, keep in your mind, penicillins and cephalosporins comes under the beta-lactam antibiotics. Beta-lactam antibiotics, keep in your mind. Penicillins and cephalosporins comes under beta-lactam antibiotics. So what is this beta-lactam? I will tell you. Everybody we know that diamond ring, but we don't know about the beta-lactam ring. As a pharmacy student, you have to aware that beta-lactam ring. You have to aware, but we don't know beta-lactam ring, and we are wearing all the rings and all. But the original ring, what the important rings we are not considering. Okay, right. So what is this beta-lactam ring? What is this beta-lactam antibiotics? That and all we will see in this video. So this is about your syllabus, penicillins and cephalosporins. See the highlighted point. This is the topic, and what are the topics I have covered here? Beta-lactam antibiotics, penicillins, cephalosporins, all this introduction structure. Okay, what is a penicillin resistance? Everything, classification of penicillins, clinical uses, adverse effect, all this we will cover in a class. See, all my notes is available in my app, that is in Google Play Store. You can be downloaded from the Pharmacokinetics for exams. Okay, after downloading it, you go to the store option. See the below store option. In the store option, if you go, so I am giving all the Pharm.D, B.Pharmacy, M.Pharmacy packages are there. Important subjects I have already covered, and I will keep on continuing that. Okay, and here, this is about my YouTube channel. Go to the playlist option. See here, playlist. There, I have arranged all my explanation videos in a subject wise. If you click on each subject, again, you will get a like this pharmacology. If you click on the pharmacology, you will get again a topic wise. Yeah, beta-lactam antibiotics compulsory. It consists of a beta-lactam ring. This is the structure of the beta-lactam ring. Simple square. And one stone like this. Here also you can imagine one stone, simple highlighted stone in this angle. And another one is a NH. That is that you know about a nitrogen. So it compulsory, it contains a beta-lactam ring. Beta-lactam antibiotics have a bactericidal action. Compulsory, it kills the bacteria. It kills. Bacteriostatic is there, bactericidal is there. Bactericidal means suicidal, just like a suicidal. It kills the bacteria. Bacteriostatic, it stops. Those antibiotics which stops the bacterial growth is called as a bacteriostatics. But here, keep in your mind, penicillins and beta-lactam, all beta-lactam antibiotics are bactericidal action. And all beta-lactam antibiotics having a same mechanism of action, same Philip, you repeat 2 times, 3 times, same cinema, repeat. Penicillins, all what are the beta-lactam antibiotics? Penicillins, cephalosporins. This is the points given in your syllabus. Apart from that, monobactam is also there. Okay, these examples are very important. Azithrionum and carbapenems, imipenem, penum, just like a penum. In Telugu, penum means chapati pulka, or they are eating that. Carbapenem, imipenem, monobacteria, like that you can remember. Beta-lactamase inhibitor. So PCMCB. So beta-lactam antibiotic. B for beta, like that you can remember. Beta-lactam antibiotics we will read in the PCMC, pharmacology, as well as we will cover in the medicinal chemistry. So PC, here see PC, pharmacology, and medicine, like that. With a simple trick you can be remember this one. Here you can see PCMC, penicillins. Beta-lactam ring is there. You observe the beta, your focus, legends should be focused only on the target. See here, beta-lactam ring. This is also beta-lactam ring. Penicillins, cephalosporins, carbapenems, beta-lactam ring. See here, monobactam, beta-lactam ring is there. Beta-lactam are important. Beta-lactam antibiotics are there. How mechanism of action? All are having a same mechanism of action. First of all, you have to keep in your mind. This is regularly, we know this person who is constructing the house wall. In the same fashion, in the bacteria also, there was one enzyme. That enzyme is called as a transpeptidase enzyme. It works like this fellow. This fellow name is transpeptidase enzyme. Like that, you can remember. Is responsible, and this enzyme is responsible for the construction of the cell wall in the bacteria. Bacteria cell wall is made up of peptidoglycan chains. Okay. So keep in your mind, transpeptidase is the enzyme. Peptidoglycans are the bricks. Okay. This is so beta-lactam antibiotics kills this person. Okay, this fellow, that means transpeptidase enzyme. See here, cell wall. Once there was a destruction of the cell wall by the antibiotic, by the beta-lactam inhibitors, automatically bacteria will be dissolved. There is no internal structure of the bacteria, all internal organ. This is the mechanism of action you have to keep in your mind. All beta-lactam antibiotics have same mechanism of action. It go and binds with the penicillin binding protein. P. Note this point. Penicillin binding protein. It is an enzyme. See here, P. Transpeptidase. This is the enzyme. Penicillins and beta-lactam antibiotics. All beta-lactam go and binds here. Inhibits. This is responsible for the cross-linking of individual bricks. See here, this is one brick. This is another brick. This transpeptidase enzyme, it joins this brick to brick. It constructs the cell wall. Now, what happened? Our penicillins and beta-lactam antibiotic kills this enzyme. So automatically, bricks will be shattered. Bricks will be also entire cell wall deficit bacteria. It undergoes the lysis. So bactericidal effect. It kills the bacteria. And keep in your mind, my dear students, very, very important one. There was a question in the examination. Why penicillins or beta-lactam antibiotics are more? It is having a high efficacy on the gram positive than the gram negative. Keep in your mind, gram positive cell construction. See here, all are peptidoglycans. We know that beta-lactam antibiotics works mainly on the transpeptidase and peptidoglycan. That's why gram positive structure. See, all are made up of peptidoglycan. But whereas here, it is single layer of peptidoglycan followed by the lipoprotein. Okay, see, these peptidoglycans are the more susceptible for the beta-lactam antibiotics. That is the main reason. Here I have already shown you the cell wall is almost entirely made up of peptidoglycan. That's why gram positives are more responsive. And that is about beta-lactam antibiotics. Penicillins, we know that it is the world's first antibiotics developed and used. And discovered by Alexander, not this Alexander. This Alexander, he conquered the entire world. He will come in the history, mythology or his history, but not this Alexander. This Alexander, here you can see Alexander Fleming. He also conquered the world with the help of penicillin. That much of his accidental fall of a spider net on the Petri dish plate, and it is made up of penicillins or antibiotics made from the organisms only. Antibiotics are made from organisms only, that we don't know. Penicillin chrysogenium. Penicillin kills the both gram positive as well as a gram negative, but gram positive, it is more effective on the gram positive because of the cell wall structure. Okay, it is a natural penicillin. Penicillin G is a natural penicillin and it is a dextrorotatory, very important point in competitive examination. Penicillin G, penicillin V are more effective on gram positive, less effective on gram negative. Aminopenicillins are extended spectrum, okay, but less effective on penicillin G against the and clavulanic acid, very, very important. It doesn't have any bacterial activity, but however, it is very, very important, very potent beta-lactamase inhibitors. I will tell you what is this beta-lactamase penicillin. This is the general structure of penicillin. It just looks like a house, a beautiful house. See here, a penthouse like that. Here 4-wall structure, here 5-wall structure. This is a beta-lactam ring. This is a 4-membered ring, and thiazolidine, number of times it was appeared in the competitive exams. Which ring is present in the penicillin? Thiazolidine. Okay, it is a 5-membered ring. It consists of an acyl side chain, 1 R. This is up to here general structure of the penicillin. This R only differs from penicillin to penicillin. R is present in the acyl side chain. Keep in your mind, this is the acyl side chain, and here you can see R structure. Penicillin G, R structure. Penicillin V, R structure. Okay, like this. All these things you have to practice in the medicinal chemistry also, pharmacology as well as penicillin resistance. This is very important, very, very important. Okay, for all pharmacists. Why these organisms will get a resistance to penicillin? That we will see now. See now what happened. All beta-lactam antibiotics kills the organism, that you know very well. Okay, by mechanical action, same I have explained. Now what happened? Resistance will be developed. How this resistance will be developed, I will tell you. Yeah, here you can see. This, see, that's why here it was killed. Organisms are killed here. Now what happened? Some of the organisms started developing of a small weapon. This weapon is called as a beta-lactamase. See here, beta-lactamase, which break down. This is a beta-lactamase, also called as a penicillinase. Penicillinase. This is having a two names. Penicillinase, beta-lactamase. Okay, this breakdowns the beta-lactam ring. That's why this rocks. Now organism rocks because it is having a weapon. That weapon, it breaks down to the penicillin. So this weapon name is called as a penicillinase, called as a beta-lactamase, breakdowns the beta-lactam ring. So automatically what happened? Drugs will be inactivated. So drug shocks, organism rocks. Whereas here drug rocks, organism shocks. Okay. Now what happened? We will not leave this thing. No. What we will do is we will add one more weapon along with the beta-lactamase. That is called a clavulanic acid. See here. This is called a clavulanic acid. So penicillins along with the clavulanic acid. Penicillin will start killing the organism. Clavulanic acid, it kills the beta-lactamase enzyme. That's why this combination is powerful. So drug rocks, organism shocks. That's okay. This point is very, very important. And differences between the beta-lactamase and penicillin. See, this is called as a beta-lactamase. This is also called as a penicillinase. Keep in your mind, beta-lactamase, these are the enzymes produced by the bacteria. These enzymes are produced by the many organisms like a Staphylococcus. These enzymes break down the beta-lactam ring. Okay, hydrolysis of the beta-lactam ring. Penicillinase, it is a specific type of beta-lactamase enzyme. Okay, penicillinase, it is a specific type of the beta-lactamase enzyme. So now you have to develop penicillinase resistance penicillin. So penicillins you give along with the clavulanic acid. This is the classification. Now you can talk to the classification. Penicillins are natural penicillins. Natural penicillins means which are produced from the nature. Nature means that is a from spider net. In our room, it will be the spider net. Okay, natural penicillins produced from the fermentation of the fungus Penicillium chrysogenium. Very, very important. Natural penicillins are again divided into two types: acid labile, acid resistance. See, these are the acid labile means which will be inactivated by the acid. So if you are taking these tablets, all are inactivated by the acid. So don't take these type of penicillin, penicillin G. It's called as a benzyl penicillin, procaine penicillin G, benzathine penicillin. All these are acid labile, inactivated by the stomach. That's why don't take to the oral. If you are taking all these acid labile orally, it will become inactive. So now you do B. B stands for victory. Acid resistance penicillin. It withstands the acid. Okay, it will not inactivated by the acid. See here, penicillin B. B stands for victory. Phenoxymethyl penicillin. All these are very, very important in the examination. They will ask you what is penicillin B. Penicillin B means it is a phenoxymethyl penicillin. Semi-synthetic penicillin. Penicillinase resistance penicillin. That's all already told you. Penicillinase resistant penicillin. Beta-lactamase inhibitors. They kills the only beta-lactam. Extended spectrum. Okay, that is which acts against gram-positive and gram-negative. Now semi-synthetic penicillin. This semi-synthetic, again, these three things I have elaborated here: penicillinase resistance, methicillin, cloxacillin, dicloxacillin, and extended spectrum like aminopenicillin. All these you have to be practiced. Beta-lactamase inhibitors. They do not have any antibacterial action. They kills only the enzyme. Clavulanic acid, sulbactam, and tabulbactam. See, this is one of the product I will show you. Amoxicillin, along with the amoxicillin, along with the potassium clavulanic acid. So this is a penicillin, okay, and this is a beta-lactamase inhibitor. Powerful. This is called as a penicillinase resistance penicillin, produced by the Horlicks company, GSK. It is a superpower. just like a Superman. It is a superpower. Okay. And the clinical uses of the penicillin: bacterial meningitis in the brain, penicillin, high doses of bone and joint infections, skin and soft tissue infections. Okay, all are very, very important. Pyogenes, bronchitis, gonorrhea, syphilis, okay, endocarditis. Very, very important. But penicillin is having a side effects also. ABCD, SSS is the shortcut. Abdominal pain, anaphylactic shock, black tongue. See, black tongue. BC, black tongue, like that. And diarrhea, SSS, skin rashes, stomach upset, and seizures, like fits, seizures. And pharmacokinetics, all are excreted by the kidney only. 90% excreted by the tubular secretion. Urine formation, that you know, chapter in the APH, tubular secretion is there. Glomerular filtration is also there. Glomerular filtration only 10% of penicillin, and tubular secretion 90%. See, give probenecid, very, very important. Probenecid and penicillin is a superpower combination, because probenecid prevents the excretion of penicillin from our body. Okay, because probenecid will act on the tubular secretion. It stops it reduces the penicillin secretion exit from the body. So penicillins will be there in our body for a longer time if you are taking a probenecid. Okay, that's why this combination is very, 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 very important, just like clavulanic acid and all. And penicillin allergy, that you know very well, a nurse will give you a subcutaneous injection, small quantity. If there is any rashes is there, don't give penicillin, because it leads to allergy. Don't give. If is there any allergy, don't give it. Here comparison coin size, you will get around a coin size. Pump, rise of a pump, just like a small pump, small balloon. And cephalosporins are superpower than the penicillins. First cephalosporin was obtained from the fungus Cephalosporium acrimonium. Next, semi-synthetic cephalosporins are the started preparation, and this is a structure. Same beta-lactam ring, but here 2R is there. R1 acyl side chain. R2 is present in the cephalosporin. This is a dihydrothiogen ring. It consists of a six-membered ring. Very, very important. This is cephalosporin structures. You have to be practice it. Here you can see R1 and R2. Cefotaxime, very powerful. This is cefotaxime. All doctors are now prescribing ceftriaxone. Now this is a superior antibiotics when compared to the availability of that. Here 5 generations are there. Keep in a first generation, second generation, third generation, fourth generation, fifth generation. All these are the, I have given a simple trick. Fa, second generation. See, some exemptions is there. Pa also comes here. Pa, IME, third generation. IME, here one exemption is there from here, and one exemption is from here. That you have to be noted down. P and a roll, like that. You can be all these. You have to be practice, and these are the adverse effects of the nausea, diarrhea, rash, pain, inflammation, and injection site. Okay, so I will end my session here. Keep rocking. Prepare well for your examination.